Good afternoon. I'm Mayor Lyrian Gaylor-Baird, and welcome to this community briefing. Joining us once again to provide interpretation is Margie Propp, and thank you, Margie. And thanks to all of you for tuning in to learn more about the latest local developments about how you can keep yourself and others safe. And keeping ourselves and each other safe are what we have been doing locally with great success. People in Lincoln demonstrate their care by wearing masks, watching their distance, and washing their hands, along with avoiding the 3 C's: crowded places, close contact, and confined spaces. These individual preventative actions, combined with our decisions at the local level, continue to make a positive impact, and our continued efforts are leading to better days ahead. Here's the latest data that compares Lancaster County to the other 4 largest populated counties in the state: Douglas, Sarpy, Hall, and Buffalo counties. The data continues to show that Lancaster County has fared better with COVID case rates. This is the case rate per 100,000 population through the week of February 20th. The state as a whole is represented by the column in red on the right, and Lancaster County is represented by the blue column on the left. And with this comparison, it is easy to see that Lancaster County, by quite a margin, has the lowest case rate of the most populated counties in the state. Now, there are many factors, but this data shows that steps taken here in Lancaster County have made a difference. This data illustrates how the actions and protocols that the vast majority of our residents and businesses have followed for many months have helped limit case numbers and decreased the impact of this virus locally. We recognize that protecting ourselves, our families, and our community takes a tremendous collective effort. We thank residents and businesses for their efforts. These efforts will continue to be important while we race against time and those variant strains of COVID-19 to vaccinate and protect more of our community members. Here with more details about our vaccination progress, as well as local conditions, is Health Director Pat Lopez.
Thank you, Mayor. As the mayor said, our local COVID-19 vaccination program continues to make great progress. Our health department, along with our partners Bryan Health, CHI St. Elizabeth, and Lincoln Surgical Hospital and Bluestem Health, as well as our long-term care facilities, have now administered almost 71,000 doses of COVID vaccine in Lincoln and Lancaster County. As many areas of the state experienced delays in their vaccine shipments last week, and several community clinics were canceled due to the weather, we were really fortunate enough to receive most of our supply, and we moved forward with our clinics last week as planned. With assistance from our community partners and volunteers, we had 2 large-scale clinics at Pinnacle Bank Arena last week. One was for people 73 years and older, and then we had a second dose clinic for healthcare providers. More than 7,700 people received vaccine between the 2 clinics. Also, a smaller clinic in partnership with Bryan Health provided vaccine to those aged 65 and older with serious medical conditions that increased their risk for severe illness from COVID-19. Just over 1,100 people were vaccinated. Also last week, we largely completed vaccinating utility workers who are next to be on the state's priority list for essential workers. Here are a few comments we want to share with you that we received from people who received vaccine last week. First, we want to thank you and your team for the remarkable experience we had at the arena. It seemed that every detail had been thought through. The team of professionals all worked seamlessly together. And another note of thanks to everyone for the well-run vaccination clinic held at PBA. So well organized and efficient, and great volunteers and health workers. I was in and out in a half an hour. And yet another person shared, we were very impressed by the smooth running organization of such an undertaking. Thanks to all the volunteers and professional staff for your service. This was truly a team effort, and I want to again thank the arena staff, our community partners, our private physicians, clinic staff, and our health department team for their help in making this positive experience for all those participating. It's very encouraging to see so many eyes smiling as people get vaccinated, and we hope high acceptance of the vaccine will continue as we receive more doses and expand vaccination to more members of the community. Our vaccination efforts this week included additional people in Phase 1B who are now eligible to receive the vaccine, including those 71 years and older, and another group of essential workers. This week, we expect to receive 5,850 doses of COVID-19 vaccine, which is our highest weekly total to date. We will be holding 3 large-scale vaccination clinics at Pinnacle Bank Arena this week. The first one is tomorrow for Lancaster County residents age 71 and older and their spouses. We are now contacting residents in that age group who have registered to receive the vaccine to schedule their appointments. People will need an appointment to receive vaccine. I also want to stress that there will be enough vaccine for everyone who has an appointment, and there is no need to arrive early. The other 2 clinics are second dose clinics on Thursday and Friday for people age 80 and older who received their first doses at the arena earlier this month. Individuals in this group are also being notified of their appointment times. The health department will again work with the arena, various partners, and volunteers to provide extra support and assistance to help ensure accessibility and mobility for our senior population being served. Next on the state's priority list for essential workers are homeless shelter staff and corrections staff. And those 2 groups will also receive vaccine this week. We want to emphasize today how important it is for those who have received their first dose of vaccine to commit to getting that second dose. That second dose is needed to build a high level of protection against the virus. When you hear that the Pfizer vaccine is 95% effective and the Moderna vaccine is 94% effective in preventing COVID-19, that effectiveness is based on 2 doses. To encourage that second dose, all those who are vaccinated receive a card letting them know when to return for their second dose of vaccine. We are asking them to bring that card with them when they get their second dose. It's also important that those who have received their second dose continue to take precautions until a significant portion of our community is fully vaccinated. That means continuing to wear a mask, wash your hands, watch your distance, and avoid the 3 C's: crowded places, close contact, and confined spaces. Last week, the state updated its vaccine prioritization. These recent changes to the vaccination phases are reflected on our website, covid19.lincoln.ne.gov. The state is now prioritizing 50 to 64-year-olds, now known as Phase 2A, prior to vaccinating the remainder of the population, which will be those 16 to 49 in Phase 2B. Serious medical conditions are no longer included in Phase 1B. We are currently consulting with our physicians in the community and analyzing some of these changes. We will continue to work together as we have been to determine vaccination options. Our website continues to be the helpful resource for the latest vaccine information, the prioritization, and which groups are currently being vaccinated. We also have new vaccine information on our online dashboard. We can now track the number of doses given by week and the total number of vaccines administered. The first step to getting vaccinated is to sign up to receive the vaccine using the secure online form at covid19.lincoln.ne.gov. As doses become more available, those who are registered will be contacted to schedule an appointment. More than 96,000 Lancaster County residents are now registered. Family members and caregivers are encouraged to assist those who need help to register. Those who do not have online access or who need assistance may call our COVID-19 hotline at 402-441-8006 to register. This form is available in English and Spanish. The health department also has interpreters available to assist callers who speak other languages. The state has a registration site. Lancaster County residents only need to register once on either of the local websites or the state website. We can securely share data as needed. Again, we encourage everyone to receive this safe and effective vaccine as soon as it's available to them. Before I move on to the risk dial and our local indicators, I have some exciting news on an additional venue for our vaccination clinics. The arena continues to be an excellent venue for clinics, but we have been looking for other locations that also can meet our needs. Starting next week, we expect to start staging some clinics at the Speedway Village, just south of Van Dorn off of Park Boulevard. The location has the space, parking, and accessibility we need for a large vaccination clinic. Joining us today is Richard Thomas, the operations manager for Speedway Motors. Thank you, Richard, for working with us to host this clinic.
Mayor, thank you for inviting Speedway to be part of this briefing. Speedway is extremely excited for this opportunity to partner together with the City of Lincoln to help our community. At Speedway, we have been working extremely hard during the pandemic to keep all of our employees, their families, and our customers safe. We know this vaccination effort is critical in the effort to combat the coronavirus. I am personally looking forward to getting my COVID vaccine when the opportunity arises. When we heard there was a need for a venue to conduct the COVID-19 vaccinations, we were eager to offer one of our facilities. The Speedway Sports Complex Fieldhouse is a perfect venue for this event. It's a large facility that is easily accessible and has abundant parking. Once again, thank you, Mayor, for this opportunity to partner with the City of Lincoln in this important vaccination effort.
Thank you, Richard. And please let your staff know how much we appreciate their work to make the complex ready for these important clinics. Now on to our COVID-19 risk dial. We have made considerable progress in February, but in the last 2 weeks, many of our indicators have begun to level off, so the risk dial will remain in mid-yellow. The 7-day rolling average of new cases shows the decline from 85 cases on February 1st to 46 on February 20th. The daily average has now leveled off, with cases fluctuating between 46 and 49 since February 8th. We have had fewer than 500 weekly cases for 3 straight weeks now. For the week ending February 20th, we had just 325 new cases. The recent cold weather and snow continue to impact the number of tests being completed this week. Testing locations had reduced hours, and many people chose to stay home. This past week, 1,300 tests were completed, the lowest weekly total since last May. The decline also continues in the number of COVID-19 patients hospitalized locally. Since February 11th, the number of local hospitalizations has fluctuated between 27 and 35 a day. Today, we are reporting 35 hospitalized, with 25 from Lancaster County and 10 from other communities. Again, our yellow indicates a moderate risk of virus spreading in our community, but we all need to continue to do our part to keep ourselves and others safe.
Thank you, Director Lopez, and thank you to Richard Thomas and to your team at Speedway for your leadership and your partnership as we put on additional vaccine clinics in the community. And finally today, we have some more good news for individuals and families impacted by the pandemic and who are in need of assistance with rent and utility bill payments. Our Urban Development Department and community partners have been distributing federal grant dollars to help residents with those bills since last July. And as of February 12th, our city has helped 857 households pay over $2 million in rent and utility bills. The city recently received an additional $13.4 million in federal funds and are ramping up our efforts to reach even more people as needed. We are working with our community partners to increase access points and streamline the application process and requirements. We will have additional information on this next week. It's important to note that even as we work to scale up the Rent and Utilities Assistance Program to administer this latest round of federal dollars, funding continues to be available through the current process for those in need. You'll find the information on our website, covid19.lincoln.ne.gov, on the Resident Resources page. And I again want to thank all of our partners who are working with us to keep individuals and families safely housed during this pandemic. And with that, we'd be happy to take questions from the media.
Director Lopez.
Any questions from the media today?
Mayor, can you hear me?
I think we may be having some technical difficulties with the Zoom. We've all had to have a lot of patience with technology during this pandemic, so thank you for yours. And with that, we'll try this again. Are there any questions from the media?
Mayor, this is Brent with Channel 8. Can you hear me?
Yes. Yes. Hi, Brent. How are you?
Okay, very good. I have a question for Director Lopez.
You'll be right here. Thank you.
Good afternoon, Brent.
Sure you're aware a lot of people were upset with the state's change to the vaccine prioritization, moving people with underlying health conditions out of phase 1B. I was just curious, like with the mask mandate, does the health department have the authority to, I guess, go against the state directive and keep those people in phase 1B inside the county?
No, we have to follow what's set forth from the governor on this. We hadn't really explored that as an option. One thing I think to make clear too is that it's for those 65 and younger. So I can't really answer that question, Brent, because I'm not sure that we have that authority to do that. But just remember, we're talking about those 65 and younger, and we're still working through the process as a community and with our physicians about what that will look like for us as we go forward for those under the age of 65.
Thank you.
Director Lopez, Riley from the Journal Star.
Hi, Riley.
Hi, Pat. Could you address the supply situation? I think you mentioned that we're going ahead kind of on schedule, but I know some other health districts, their supply chains were interrupted. What's different about us?
I don't know. We've always thought we're very special here, Riley. And I have to say, for some reason, Douglas County and Lancaster County and Two Rivers Health Department are in the same delivery schedule. And we are the three departments that received our vaccine on time last week. And I'm happy to report we received vaccine today. So I'm really thrilled. Some of the other departments have their vaccine coming in. Some are still waiting for more vaccine. We were missing about 600 doses of our Moderna vaccine, but we have received that now. And those are like for second doses. So we just feel, honestly, we just feel very grateful that we're able to have that, because for those other departments, it was terrible for people who had their hopes up to get their vaccine and then to have the clinics canceled. So I just feel grateful.
As you mentioned, later this week, there'll be some follow-up clinics, second dose clinics for the 80 plus group that was vaccinated earlier this month. What efforts are you guys undertaking to ensure those folks kind of turn out? I mean, I imagine many of them want to be fully vaccinated, but life happens. And are you reaching out to people to let them know about the follow-up appointment?
Yes, we have reached out to them through various methods, both through voicemail, our electronic measures, but we've also called them to just schedule their clinics and make it as easy as possible for them to get in. And you might recall when we first did this, we did the vaccines on one day, and we shifted to 2 days to do about 2,500 vaccines each day to ensure there's more spacing between people and that it's easier for people getting in and out. And based on the experience that we've had so far, I expect most of our individuals to return. We've had a really high second dose of vaccines administered here, but we're coming into doing more now, and so we'll have more data to look at soon.
Director Lopez, this is Bill from 1011. I am curious, when the DHHS announced changes to the prioritizations and removing people with underlying health issues, if that came as a shock to the health department, or if you guys were consulted previously about that, and then in the days since, what the reaction has been from the local community, the medical community. As you mentioned, you have been having discussions with them.
The health departments were informed beforehand, and of course it was a concern to us. It was a large change, and we were trying to grasp some of the details provided. I think, our community has really been flexible and adaptable during this process. And our medical community and our health department staff are keeping focused on doing the very best that we can to meet the needs of the members of our community, and especially those with serious health conditions. And we're going to continue to work through that.
Is it possible that those serious health issues would be prioritized within the specific age groups as we move forward?
I think that is possible, as we move forward. We've started doing some of that, and we're going to continue to work that way with the medical community as we go forward until we receive other direction.
And you won't be changing the questionnaire or the registration that includes information about whether you have underlying health issues, correct?
No, we're not changing that this time.
Director Lopez Riley with the Journal Star again. I have a non-vaccine question. Next week, Girls State basketball tournament returns. Do you have any concerns about local directed health measure compliance, including the mask mandate, with the people that are, expected to come to the city? And do you expect kind of large amounts of people to make the trip?
Well, we anticipate there will be people coming, and we're looking forward to that. We're looking forward to people attending safely and visiting our restaurants and other locations in the community. We've been meeting weekly with NSAA and Jeff Mall, and we will be meeting with the administrators and coaches next Monday evening to go over what's expected from the DHMs here, and they will provide that out to the schools and those that are attending. We have all kinds of safety measures in place at Pinnacle Bank Arena. We've worked with Lincoln Public Schools, and we expect it to be a really positive experience for those attending and for our community members and our businesses. And I'm excited to have State and Boys State this year.
Are there any further questions? All right, then, well, thank you once again to Richard Thomas and everyone at Speedway Motors for being with us today and in this pandemic as we work to protect our community members. And thank you to everyone who's watching for helping to keep Lancaster County one of the safest places to be in Nebraska. The steps you take to stay safe and to stop the spread of COVID-19 by wearing masks, washing your hands, and watching your distance from others while avoiding crowded places, they are making a real difference. Thank you. Thank you, Margie.